So coming to the deep structures of neck, we have thyroid gland, thymus, trachea and esophagus are there. Out of this, thyroid gland is very important. Thyroid gland, it is an endocrine gland and it manufactures its own hormones and it releases whenever it requires, and it's the only endocrine gland that depends upon the outer environment for the manufacturing of its raw materials, and it is a ductless gland, and the thyroid gland is weighs about 25 grams. It is lies opposite the C5, C6, C7 and T1 vertebra. So the thyroid gland is a H-shaped gland and it lies opposite the C5, C6, C7 and T1 vertebra, and it is an endocrine gland. It is a ductless gland and it depends upon the outer environment for the raw materials, and also it synthesizes its own hormones and releases whenever they require. And thyroid gland possesses a rich blood supply. It has a very rich blood supply compared to that of adrenal gland and kidney. It has a very rich blood supply. So coming to the thyroid gland, it is covered by true capsule and false capsule. True capsule, it is derived from the condensation of the fibrous stroma of the gland. And coming to the false capsule, it is derived from the pretracheal fascia. So the pretracheal fascia, here it splits to enclose the gland. So the anterior layer and posterior layer. The anterior layer of the pretracheal fascia, it extends thickened from the lateral lobe of the thyroid gland, from the medial surface of the lateral lobe of thyroid gland to the thyroid cartilage here, to the cricoid cartilage here, by forming the ligament of Berry. So the anterior layer of the pretracheal fascia, that is nothing but the anterior layer of the false capsule, it is thickened here from the medial surface of the lateral lobe of thyroid gland to the cricoid cartilage here, forming the ligament of Berry. And the posterior layer, it is very thin, covering the posterior part of the thyroid gland, and it is continuous with the posterior fascia of the opposite side. And here what happens is, because of the posterior layer of the false capsule, it is very thin. The posterior layer of the false capsule is very thin, so any swellings or any tumor extends backward without any swelling on in front. So by obstructing the structures of the back side, that is esophagus, whatever structures present at the back side of the thyroid gland, it obstructs the structures because the tumor goes backward. So the thyroid gland, it is invested by two capsules. One is true capsule, other one is false capsule. True capsule, it is derived from the fibrous stroma, condensation of fibrous stroma of the gland, and false capsule, it is derived from the pretracheal fascia. The false capsule, it enters the gland and splits into two layers, anterior layer and posterior layer. Here the anterior layer covers and the posterior layer is ill-defined. And one more important thing is, the anterior layer, it is thickened from the medial surface of the lateral lobe of thyroid to the cricoid cartilage by forming the ligament of Berry. And also this false capsule, it is also nothing but a pretracheal fascia. After enclosing the gland, it is attached to the hard bone and also oblique line of thyroid cartilage. This way the thyroid gland moves up and down with the deglutition because of the oblique line attachment to the hard bone, as well as oblique line of thyroid cartilage, as well as cricoid cartilage through ligament of Berry. That's why the thyroid gland moves up and down with deglutition because of its attachment to the hard bone, thyroid cartilage, as well as cricoid cartilage. So that is about the coverings of the gland. And coming to the lobes of the gland, thyroid gland, it is like a butterfly shape. It consists of having two lobes. This is the isthmus of the thyroid gland. The two lobes, they are attached by the isthmus. Each lobe has apex, base, superficial surface, medial surface and posterolateral surface. So each lobe of the thyroid gland consists of apex, base, superficial surface, medial surface on the medial side, which is related to the trachea and esophagus, and the posterolateral surface. So when we take the transverse section, coronal section of the thyroid gland, it appears here like this. This is the superficial surface, this is the posterolateral surface, and this is the medial surface. Here we have cricoid cartilage is here, and this is the esophagus, and it is invested by a false capsule which is derived from the pretracheal fascia. So the thyroid gland, each lateral lobe consists of three surfaces: superficial surface, posterolateral surface. This is the posterolateral surface, and this is the medial surface. Okay, this is the medial surface, and this is the posterolateral surface, and this is the superficial surface, or we can call it as anterolateral surface. So that's about the surfaces of the thyroid gland. And coming to the borders, thyroid gland is having two borders, anterior border and posterior border. Anterior border separates the superficial surface from the medial surface. Posterior border, it is not seen here. Posterior border, here is the posterior border which separates the medial surface from the posterolateral surface. So that's about the borders. Coming to the relations, apex it is related to the oblique line of thyroid cartilage. So apex extends up to the oblique line of thyroid cartilage. We know that the thyroid cartilage So this is a thyroid cartilage. We on either side. So on either side, this is the thyroid cartilage. On either side of thyroid cartilage, we have oblique line of thyroid cartilage. So the apex extends down upwards up to the oblique line. Here is the thyroid cartilage. The apex extends upward up to the oblique line of thyroid cartilage, where the apex it is related medially to the inferior constrictor muscle and laterally to the stenohyoid muscle. It is related medially to the inferior constrictor muscle and laterally to the sternothyroid muscle. And coming to the base it extends up to the third, fourth and fifth tracheal rings, and the base it is related to loop of inferior thyroid artery, and here the apex is related to superior thyroid artery as well as external laryngeal nerve. See, this is the superior thyroid artery and this is the external laryngeal nerve. The external laryngeal nerve passes deep to the superior thyroid artery, and the base it is related. This is the base of the thyroid gland. This is the apex and this is the base of the thyroid gland. The base it is related to a loop of inferior thyroid artery and also recurrent laryngeal nerve. The recurrent laryngeal nerve passes above the loop of inferior thyroid artery or pass below the thyroid artery. So this is the base is related to inferior thyroid artery and recurrent laryngeal nerve, and the apex extends up to the oblique line of thyroid cartilage, where it is related to the inferior constrictor medially and sternothyroid laterally. And it is related to superior thyroid artery, which is a branch of external carotid artery, and also external laryngeal nerve, which is a branch of vagus nerve. The nerve lies in a deeper plane compared to the artery. And coming to the base is related to the third, fourth, fifth, sixth and tracheal rings, and here it is related to loop of inferior thyroid artery and also recurrent laryngeal nerve. The recurrent laryngeal nerve it passes above or below the thyroid gland, or sometimes it passes in between the branches of the inferior thyroid artery. It passes above the loop of the inferior thyroid artery or it passes below the loop of the inferior thyroid artery, and sometimes it passes in between the branches of the inferior thyroid artery. So that's about the apex and base. Okay, coming to the surfaces, I have already told when we take the coronal section of thyroid gland, this is the superficial surface, this is the posterior surface, and this is the medial surface, right? So coming to the superficial surface it is related to muscles, sternothyroid, sternocleidomastoid and omohyoid. The superficial surface related to sternothyroid, sternocleidomastoid. First is the sternothyroid, next is sternocleidomastoid, and next is omohyoid. From superficial, from within outwards, it is related to sternothyroid, sternocleidomastoid and omohyoid. The superficial surface is related to these three structures, these three muscles. Okay, and coming to the posterolateral surface, on the posterolateral surface, it is related to the posterolateral, this is also the posterolateral surface, right? So posterolateral surface, it is related to carotid sheath and its contents. We know that in the carotid sheath, we will have internal jugular vein is here, vagus nerve on your posterior aspect, and internal common carotid artery along with the internal carotid artery. So the posterolateral surface, it is related to the carotid sheath and its contents. So the carotid sheath, the anterior wall of the carotid sheath is derived from pretracheal fascia and the posterior wall is derived from prevertebral fascia. And here is the posterolateral surface of the thyroid gland. It is related to carotid sheath and its contents. Or what are the contents? Common carotid artery along with the internal carotid artery, internal jugular vein and vagus nerve. So these are the contents of the carotid sheath, which is related to the posterolateral surface of the thyroid gland. Okay, and coming to the medial surface. Medial surface, it is related to two tubes, two muscles, two nerves. So what are two tubes? The medial surface, it is related to trachea and esophagus. Here is the esophagus. Two tubes, it is related to trachea or the trachea or larynx, pharynx or esophagus, right? So trachea at 6 at the level of C6, it continues as a larynx, and this one, the pharynx at the level of C6 continues as the esophagus. So the medial surface, it is related to two tubes, that is two tubes. The medial surface, it is related to two tubes. What are the two tubes? Trachea and esophagus, right? So trachea and esophagus. And coming to the two nerves, we know that it is related to two nerves, that is the medial surface related to two nerves, that is external laryngeal nerve and recurrent laryngeal nerve. So the medial surface, it is related to two nerves, that is external laryngeal nerve and recurrent laryngeal nerve. So two nerves, it is related to two nerves, external laryngeal and recurrent laryngeal, and it is related to two muscles, that is cricothyroid muscle and inferior constrictor muscle. We know that the inferior constrictor muscle, it is a muscle of pharynx. It goes, the fibers goes backwards and inserted to the posterior part of the pharynx. The inferior constrictor muscle arises from the oblique line of thyroid cartilage as well as from the cricoid cartilage. So the inferior constrictor muscles has thyropharyngeus part and cricopharyngeus part. Okay, and so the two tubes, two nerves and two muscles. Two muscles, what are those two muscles? It is related to inferior constrictor as well as cricothyroid. So the medial surface, it is related to inferior constrictor, two muscles, inferior constrictor and cricothyroid, two tubes, trachea and esophagus, two nerves, external laryngeal and recurrent laryngeal artery and recurrent laryngeal nerves, and two arteries, superior thyroid artery as well as inferior thyroid arteries. So that's about the medial surface. And also from the medial surface, if the anterior layer of the false capsule, extends to the cricoid cartilage and is attached to the cricoid cartilage, forming the ligament of Berry. That is also an important part of the medial surface. So the anterior layer of the false capsule, it is thick and it is attached to the cricoid cartilage here, forming the ligament of Berry. That's also an important feature of the medial surface. So that's about the surfaces of the thyroid gland. And coming to the borders of the thyroid gland, it is having anterior border and posterior border. Anterior border separates the superficial surface from the medial surface. Here we can see on the anterior border, we will able to see the superior thyroid arteries, and coming to the inferior thyroid arteries, and coming to the posterior border, we can see the anastomosis between the superior and inferior thyroid. So the posterior border separates the medial surface from the posterolateral surface. Here we can see the anastomosis of the superior and inferior thyroid arteries, and also parathyroid glands are also present. Parathyroid glands are also present on the posterior border of the thyroid gland. The anterior border separates the superficial surface from the medial surface. It consists of superior thyroid arteries, and coming to the posterior border it separates the medial surfaces from the posterolateral surfaces, and it consists of the anastomosis of the superior as well as inferior thyroid arteries. So that's about the borders of the thyroid gland. And coming to the blood supply of the thyroid gland. So the thyroid gland, it is supplied by the superior thyroid artery as well as inferior thyroid artery. Some accessory thyroid arteries are also present, which are derived from the tracheal and esophageal arteries, and also arteria thyroidea ima, which supplies the isthmus of the thyroid gland. So coming to the superior thyroid artery is a branch of the external carotid artery, and here a branch from the superior thyroid artery anastomoses along the upper border of the isthmus. Here the isthmus is the isthmus which connects the two lobes. See, which connects the two lobes. It is about 1.25 centimeters. It is about 1.25 centimeters, and it connects the two lobes. And sometimes from the isthmus, a extension, a fascia extension is there, that is called levator glandulae thyroideae of the pyramidal lobe of the isthmus to the hyoid bone. A fascia fibrous band extends, that is called levator glandulae thyroideae. Thus, and the isthmus has two borders, upper border and lower border. Along the upper border, we can see the anastomosis of the superior thyroid artery, and along the lower border we can see the inferior thyroid veins. So that's about the relations of the isthmus. Coming to the blood supply, from the superior thyroid artery along the upper border of the isthmus, the branch from the superior thyroid artery anastomoses with the other branch, corresponding branch of the from the other side. And coming to the inferior thyroid artery is a branch of the thyrocervical trunk of the subclavian artery, second part of subclavian artery. It forms a loop here, and along the posterior border, a branch from the superior thyroid artery and inferior thyroid artery, they anastomose with each other. So, inferior thyroid artery is a branch of the thyrocervical artery, which is in turn is a branch of the subclavian artery, which enters in the gland through the base, and along the posterior border we can see the anastomosis between the superior thyroid artery and inferior thyroid artery. And also arteria thyroidea ima, which is also a branch from the thyrocervical trunk, which also supplies the isthmus of the thyroid gland. And these are the blood supply, and also some accessory thyroid arteries are also present, which are derived from the tracheal and esophageal arteries. So that's about the blood supply of the thyroid gland. So totally 4 arteries supply the thyroid gland. One is superior thyroid artery, and the next one is inferior thyroid artery, and the third one is arteria thyroidea ima, and the fourth one is numerous accessory thyroid arteries derived from esophageal and tracheal arteries. Okay, so that's about the blood supply of the thyroid gland, arterial supply of the thyroid gland. Coming to the venous drainage, so from the superior thyroid veins and inferior thyroid veins, they drain into the interjugular vein, and the third pair of thyroid veins are the inferior thyroid veins. They drain into the left brachiocephalic, mostly on the left brachiocephalic vein. Superior thyroid veins and inferior thyroid veins, they drain into interjugular veins, and the inferior thyroid veins, they drain into left brachiocephalic vein. That's about the venous drainage. And coming to the lymphatic drainage, so the upper part of the gland, it is drained into prelaryngeal and jugulodigastric group of lymph nodes, and the lower part of the gland, it is the lymphatics drained into lymphatics of recurrent chain. So the upper part of the gland, it is drained by prelaryngeal nodes as well as jugulodigastric group of lymph nodes here, and the lower part of the gland, it is drained by lymphatics of recurrent chain. So that's about the lymphatic drainage of the thyroid gland. And coming to the nerve supply of the thyroid gland, the thyroid gland is supplied by both sympathetic and parasympathetic nerves. The parasympathetic nerves are derived from the vagus nerve as well as glossopharyngeal nerve, and the post-sympathetic fibers, they also supply the gland. Their function is, and they cause vasomotor supply of the gland. And the parasympathetic nerves are derived from the external and recurrent laryngeal nerves, that is nothing but the vagus nerve. Their function is not unknown, but thyroid gland is supplied by both sympathetic and parasympathetic nerves. So that's about the nerve supply of the thyroid gland. So that is about the thyroid gland. Trachea, esophagus కొంచెం outlines ఇచ్చి Coming to the other deep structures of the neck other than thyroid gland, we have thymus is there. Thymus, it is an important organ of the lymphatic system, and the thymus, it is a irregular bilobed structure situated in front of the superior mediastinum, in front of the fibrous pericardium as well as the arch of aorta, and is situated in the superior as well as anterior mediastinum. And the thymus, it is weighs about 10 to 15 grams at birth, and it increases at puberty up to 30 to 40 grams, and later on it degenerates in a mid-adult. Again it reaches the weight of 10 grams, and here it becomes further, it degenerates and forms a fibrofatty tissue. It is an organ of huge entity because in cadavers also we can't see the thymus properly. It is a asymmetrical bilobed structure. Okay, and thymus, it is an important organ of a lymphatic system. It consists of more number of lymphocytes, and the characteristic feature of thymus is it presence of Husserl's corpuscles, that means a degenerate mass of epithelial cells surrounded by few epithelial cells, that is Husserl's corpuscles are present in the thymus. It's an important organ of lymphatic system which helps in defense mechanism. Okay, and coming to the trachea, it is situated in front of the esophagus, and the trachea is made up of hyaline cartilage. It is made up of 16 to 20 tracheal links, and the length of the trachea is about 11 centimeters, and the posterior part of trachea is devoid of cartilage, and it is covered by smooth muscle in order to avoid corrosion over the esophagus. Because if the trachea is covered on the posterior aspect also by the tracheal rings, what happens? The esophagus gets damaged. So the posterior part of trachea, it is covered by smooth muscle, that is called trachealis muscle, and the trachea at the level of lower border of C6 vertebra, the larynx continues as trachea. Okay, and coming to the esophagus, it is continuous as the pharynx at the level of C6. It is about 12 centimeters. It is about 12 centimeters long, and the esophagus here it continues pierces the esophageal opening of the diaphragm, and it continues with the stomach. So that's about the esophagus. And coming to the esophagus, in front it is related to the trachea, and the trachea here it is overlapped by stenothyroid, stenohyoid muscles, and it is also related, on either side it is related to the lateral lobes of thyroid gland, and it also related to common carotid arteries and internal carotid arteries. So that's about the other structures. Thymus, a brief explanation of the thymus, trachea and esophagus. Out of this, the thyroid gland, it is very, very important. So that's about the deep structures of the neck. నేను హిస్టాలజీ చెప్పేస్తాను ఇప్పుడు. లేకపోతే కంటిన్యూషన్ ఇది ఆఫ్ చేసి మళ్ళీ వెంటనే పంపిస్తారా? కంటిన్యూషన్ బోర్డు రబ్ చేసేయాలి.